doing for the next 1 hour, inshallah. Okay, thank you for sacrificing your precious weekend for the session, inshallah. There will be 4 components of our talk or our discussion today. Okay, so initially this is supposed to be mentorship revision briefing sahaja. It should be very quick, but alang-alang kita dah gather together, so I would like to put in a few more things that I think will be beneficial and important for you all before you start housemanship soon. Okay, so I believe all of you dah dapat hospital masing-masing, whether you get your first choice or not. InsyaAllah that is the best training hospital for you lah. Okay, InsyaAllah hospital mana-mana pun, if you are prepared, if you are proactive to work, inshallah you will learn a lot and you will become a good doctor, inshallah. Okay, so the first part, we'll go through and have a look at reality of tagging. What is the current workload untuk houseman? Okay, a little bit on off-tag assessment so that you have an idea how you will be assessed after off-tag. So you dah tahu what awaits you. So hopefully you can do the necessary to prepare for housemanship soon. Okay, so the second part will be after dah tahu what is your reality of tagging, apa you punya assessment format. Okay, then we will together identify knowledge and skills gap. Okay, so regardless where you graduated, okay, I believe all of us have some skills or knowledge gap. Maksudnya ada benda yang kita tidak diajar waktu medical schools, but we are expected to do or perform those tasks when you are a houseman soon. Okay, so you have few more precious weeks to prepare yourself in terms of your documentation, more importantly in terms of your mental preparedness, but also skills and required competency in terms of knowledge. Okay, so kita akan go through knowledge and skills gap. Okay, I really hope you have your notebook with you, jot down important points. Okay, so bila kita dah identify apa kita punya knowledge, skills and gap, then you should be able to come out with some to-do list, okay, or checklist, what to do, what you need to prepare before you actually step into the ward as taggers later. Okay, okay, and towards the end of session saya akan bagi tahu how to join the mentorship revision. Okay, and you boleh terus join the senior houseman WhatsApp group, okay, of your respective hospital. So please stay up till the end. Nanti you will need to submit the mentorship survey form, and at the end of the survey form you will get a link to join your senior houseman group. Okay, so at any point of time, doctors, if you have any question, you can unmute yourself or you can ask in the chat box. I will try to attend to those questions along the way. Okay, so all of you, congratulations, have gotten your hospital. Okay, your PTM will be in I believe in 4 weeks time. Okay, then you will have hospital orientation. So your batch is quite unique in the sense of you punya hospital orientation tu ada long weekend. We have Raya Haji. So I really hope you will get to know your first posting before the long holiday, so you can do focus revision and you can arrange pre-tag to go and have a look and orientate yourself to the ward before your actual tagging. Okay, so you have about 6 weeks to go. It's quite a long time and enough time to do the necessary to ensure you prepare yourself and be ready bila you start tagging, start jaga ward nanti. Okay, okay, so let's spend a few minutes to read this. This is the feedback saya follow up yesterday houseman from first intake of this year. So first intake they started tagging in April, okay, end of March. So diorang dah kerja about 2 months, okay. Yang intake sebelum you baru nak start tagging next week. So ini yang first intake. So this is the feedback on the current workload. Okay. This is medical. I don't want to reveal hospital mana. Okay, so medical, satu houseman jaga 26 patient. This is not tagging anymore. They still come back at 11 PM. Okay, another senior houseman, intake yang sama, in ONG, mentioned that he is taking care of 48 patient alone. 48 patient alone, satu ward, and labor room with 20 labor room is one houseman as well. So that is quite, not quite lah, it's very heavy. Okay, it's very heavy, it's very, I would say crazy lah. Okay, so just to show you that this is the reality, so you need to kind of anticipate this. Bukan nak takut-takutkan you all, but I don't want to macam hide the reality from you. Okay, so please at least do the necessary so that you can macam brace for the impact, so tak terkejut sangat. You know what to expect nanti. Okay. Okay. So what to expect on your first day, doctors? Kena buat apa on your first day? What Okay, a good question by your colleagues. Okay, somebody asked, how about the hospital orientation if you are having a long weekend? I honestly don't think they will cut short the hospital orientation. I don't think they will cut short the hospital orientation. KKM is taking the orientation quite seriously now. So I really hope they will extend your hospital orientation. So they will cover up the missing days because of the public holiday lah. Okay. Okay. So what do you anticipate in your first day, houseman? You rasa-rasa you kena buat apa? First day of tagging, report, dah dapat logbook, report duty to the clinic, pass all the documentation, okay. Dah report duty, then you go into the ward, okay. Most of you dah tengok contoh video hospital Serdang, what happened on your first few days kan? Okay. So introduce yourself to everyone, very good. First day of tagging, job scope is identical to any senior houseman, kecuali you all mungkin you jaga kurang sikit patient berbanding senior houseman lah, but essentially you will be expected to do, okay, we expect you to perform or apa-apa kerja yang sepatutnya houseman perlu buat. So blood taking, doing rounds, so simple things like discharge, okay, take take blood, so they will anticipate you to know how to do that. Okay. Okay, so let's quickly recap. I think most of you are quite familiar with these slides. Okay, just imagine yourself. Okay, this won't happen on your first day lah. Your first day you report duty to clinic dulu, so you will arrive to the ward at 9 PM, 9 AM, 10 AM waktu orang tengah buat rounds, bila ebo specialist dah tengah buat rounds, in the middle of the rounds. Okay, but your second day, bila you datang daripada awal pagi, this is the usual ward routine, okay, that HO kena buat. Okay, usually you will come to take morning blood for your patients. Okay, the morning blood is the routine investigation kita repeat every day. Okay, and then you will start doing rounds. Okay, macam mana buat rounds, doctor? How do you do rounds? So rounds ni you kena you kena assess condition patient you. Kalau you tengok tadi sini hospital tu dia jaga 26 patient, so mungkin lah your first day you'll be in charge of like 6 or 8. Okay, one cubicle is usually 6 or 8 patients. So you will need to understand why each patient is here, kenapa admitted, what have been done to the patient. So what is the current condition of your patient? So you will need to ask certain questions. Do a quick relevant physical examination as part of your rounds, and then you trace the latest investigation result, and that would be the whole of your rounds lah. Okay, so you must be able to decide patient ni dah makin okay atau tidak. Okay, so your MO come, you will need to present all those cases in your cubicle. So kalau you jaga 6 patient tadi atau 8 patient, so you have to present each of your patients. Okay, usually we won't vomit out everything that we write dalam DHT tadi. You need to summarize, you need to simplify, okay, summarize the condition of your patients and present what is your plan of management. Do you think this patient can be discharged? Okay, or you need to continue the management? Okay, so somewhat MO will come first, then specialist will come later. Okay, ada juga certain department yang MO and specialist come together. So you will need to present one shot to your MO and specialist. Okay, and then after your round finish, then all the patient yang you jaga tadi, kalau you jaga 6 patient, okay, so biasanya akan ada new blood taking to be repeated, referral, scan request, there's some procedures that you need to arrange. Okay, you can arrange, ask for the consent. If you are in surgical based department, you will need to prepare or book patient for operations. Okay, so these are your day in and day out tasks. Okay, meanwhile you will have other additional job scope. Okay, so new cases, so you will need to clerk the case, and then you need to execute all the plan of management. Okay, nak ambil darah, nak startkan antibiotik, so branula, blood culture, urinary catheter, RAS tube if needed. Okay, and then any patient with active complaint, doctor, okay, why do we call houseman house officer? Because you are in-house, you are always in the ward. MO after rounds, MO and specialist after round, diorang akan pergi dekat klinik, diorang akan pergi OT, they will go and see patients in emergency department. So yang tinggal dekat ward ni houseman lah, in-house. Okay, so bila you dekat ward, anything goes wrong with the patients atau patient ada new complaint like sakit dada lah doktor, branula saya sakit lah, saya rasa macam demam lah. Okay, so all these are HO level. To attend to the patient, assess, you must come with some preliminary diagnosis, what is happening to the patient, and discuss with your medical officer accordingly how to manage that. Okay, that is part of your task as houseman, and this is something you really need to work on during tagging. Okay, sebab bila tagging ni, you punya job scope sama dengan senior houseman, but usually you will have another senior houseman working with you in the ward. Okay, so if you have anything yang you tak sure, you can always ask or double check. But once you off tag, doctor, once you off tag, you are in charge of 1 or 2 wards alone. So you really need to be confident with attending patient with active complaint. Okay, doctors, can you make sure you are muted? Okay, sorry. Okay. 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 So and then okay, apart from all those active new complaint, you will also need to help your nurses with indent medication or order medication. So you need to know how to write a proper prescription. Okay, most hospital nowadays you order the medication in the computer system. Okay, so you will need to learn and practice that during your hospital orientation. Okay, Okay, you will need to initiate resuscitation. So waktu tagging tu, please assist your medical officer and senior houseman how to resuscitate. Okay, bila you dah jaga ward seorang-seorang atau 2 ward, biasanya bila malam, we don't have enough houseman, so one houseman need to be in charge of the one whole ward or 2 ward. Okay, so any unstable or collapsed patient, you should be able to start in resuscitation, okay, before your MO come. Okay, there's one question by your colleagues. Okay, for active complaint, doctor, for example, discomfort due to CPD insertion. For example, patient has urinary retention. Do we need to remove the CBD? Okay, so if patient have any complaint, our task as doctor, okay, so patient akan come with complaint, shortness of breath, branula sakit, CPD discomfort. Okay, so you need to assess why is this thing happening. Okay, a simple one is painful branula lah. So you have to make sure whether it's still working or not. Okay, kalau dia dah bunk and ada some sign of infection, then it means you need to remove the branula. Okay, do macam cold compress. Some center dia akan start antibiotics if patient have temperature. So same goes to discomfort at CBD. So you kena tengok lah how long has the CBD has been inserted. Okay, if it's new, whether it is in situ, ada tak urine. Kalau dah lama, dah masuk for few days, is there any sign of infection, cloudy urine, patient develop temperature? So you manage accordingly on the diagnosis or what is the underlying thing that happens. Okay. Okay, I hope that answer the questions. Okay. If you are not sure, it's okay, doctor. Nobody straight away masuk-masuk tu tahu everything. That's why you dah habis medical schools, kita kena buat houseman. That's why houseman kena tagging dulu setiap posting. Okay. Okay, doktor, kalau senior houseman tak ada dekat ward, boleh tanya siapa. You can always ask your nurses. Okay, kebanyakan benda nurse tahu nak buat apa. Okay, especially the procedures, all the senior nurse, you tengok yang macam dah quite season, quite matured sikit tu, they are very experienced. Okay, so you can always ask your nurses first. Okay, kalau tak ada senior houseman, don't worry. If there's no senior houseman in the ward, doctor, you have the senior houseman in the WhatsApp group. Okay, ada mungkin dalam WhatsApp group yang Medicorp bagi you access nanti is everyone in the hospital. Usually every department ada dia punya WhatsApp group atau Telegram group. So you can always SOS in the group. Or what we usually do is, okay, kalau you dah pre-tag, okay, by right you dah kenal few friendly senior houseman that you feel safe to ask questions, okay, and you boleh tengok dalam jadual mana senior houseman yang bekerja dalam shift yang sama. Mungkin dia kerja dekat ward lain tapi dia kerja shift yang sama. You can call them, okay, because you already have their phone number via the WhatsApp group, okay. No worries, especially if you're still tagging, you always have the what I call license, the stupidity license, or usually people won't orang tak marah lah kalau you tanya questions. Okay, remember your golden rule of housemanship. You need to ask question, you need to try procedures. Okay, okay, kena tanya. Just find people to ask, your nurses, your senior houseman. In fact, you can go to your MO juga. Okay, okay, and remember dekat ward ni usually you have BD or TDS round. Okay, ada round pagi, petang dengan malam. So you kind of repeat everything. There's a lot of routine. And kalau you jaga 26 patient ni, 26 patient round pagi, 26 patient round petang, 26 patient juga round malam. Okay, so there's a lot of things need to be done, and ada a lot of interjection tengah-tengah, you tengah buat round, ada new case lah, lepas tu staff nurse, doktor tolong insert branula, doktor apa ni, patient ni macam tak okay. So it is very messy and quite overwhelming. Okay, so prepare yourself on things yang senang kita nak manage. Okay, maksudnya the things that you can easily ace ataupun senang you nak jadi pandai, be good at it, is the procedures. Okay, so practice betul-betul macam mana nak insert branula, blood taking. Okay, all these procedures, it doesn't take a lot of time to be good at it. Okay, in fact, I think most of you dah join medical punya clinical skills workshop. Okay, so rewatch the video waktu pre-type, you can observe, you can do these procedures so that at least you can ace at the procedures. Okay, you will need longer time to be good at doing rounds, to be good at presenting. It will take a lot of practice sebab ada banyak different cases dekat dalam ward tu. Okay, so let's focus on the things that you can be confident and good at even in your first few days. Okay, procedures, your ABG, your ECG, those are things that you can start working on it and you're quite familiar already daripada you punya medical schools. Okay, okay, CME and your assessment and pass over lah. Okay, this is your day in and day out. This is your day in and day out at assessment. Okay, so make sure you work on things ataupun benda yang common lah. Okay, so common medication. Okay, common medication used in Malaysian hospital. Usually you will have your pharmacy punya briefing later. Okay, you will also okay, most of you, I think, have this drug and disease list. Okay, so you can have a look what are the common medications. So please, doctor, we have we have highlighted the common medication. So you need to recall lah, okay, amlodipine ni group apa, indication apa, okay. Okay, this is 5 core knowledge that you need to work on before you actually go into the ward as takers. Common medication, okay. What we learn in medical school is the generic name, but usually bila masuk dekat ward, kita panggil dia punya brand name, nama panggilan dia lain. Okay, so that's why we come up with this. So you need to know the common medication so that you will be able to prescribe the medication correctly. Okay. Common diseases, okay, as per your HO logbook, okay, so that you know how to do rounds. Okay, investigation, interpretation, doctor, let's jot down what you need to know, what you need to work on. Investigation, interpretation is something you can work on before you start taking ni, walaupun you tak tahu you punya first posting apa lagi, okay, because you will encounter every day regardless of which department you are in. ECG, okay, chest X-ray and abdominal X-ray, ECG, ABG, and another one is CTG if you start in ONG. Okay, can you work on that? Okay, 1 ECG a day, 1 ABG a day, okay, 1 chest X-ray a day. There's a lot of free YouTubes or free revision material, and I believe you also dah ada buku ECG made easy. So make some effort, okay, to start interpreting. Okay, dah tak perlu lagi dah go through the basics anymore, maksudnya step by step apa semua tu. Satu hari take 1 strip and try to interpret, and then you improvise from that. Okay, this is the time for you to start practicing. Okay, investigation and normal lab values. Okay, I believe if you have started to revise the common diseases, you should be able to recall the important lab values. Okay, untuk yang dah join Flash, we have discussed in great detail about dengue. So you must be able to recall dah berapa normal hematocrit, HB, platelet, total white cell. Okay, this is a very few numbers, not much. Okay, FBC, renal profile. What's included in your renal profile, doctor? Your creatinine, your urea and your electrolyte. Okay, potassium, sodium, your liver function test and coagulation. Okay, so less than about 10 numbers that you have to remember by heart. Okay, and last one is common abbreviations. Okay, mana nak tengok common abbreviations, doctor? You need to understand the abbreviation so that bila you masuk dalam ward nanti, you can understand the discussion. Okay, have you been to the ward, join ward rounds? I think yang local graduates, you must have some experience following ward rounds. Can you follow the discussion? Can you appreciate the discussion during rounds? Okay. So if you have been to the rounds, you know it's quite fast, quite fast. Then nowadays okay sikit sebab dah tak pakai face shield. Dulu kalau pakai face shield lagi lah macam pekak sikit. Okay, so it is very fast. Okay, and they use a lot of abbreviations when communicating, bila present, bila discuss case, everyone use common abbreviations. So you need to be familiar so that first you can appreciate the discussion waktu round. Second, you can understand documentation in the case note or in the BHT. Okay, so good source to revise your common abbreviations is the Ampang HO guide. I will reshare the Ampang HO guide punya link at my Telegram channel shortly after the session. Okay, so Ampang HO guide, Amalina notes, Hanif notes will be good reference for you to be familiar with the common abbreviations. Okay. My aim, especially for those who have been to the Flash and Advanced HO, is you must be able to appreciate the BHT, and you must be able to write your own review or clerking notes on your first day. Okay. In order to do that, you must be familiar with the common abbreviation and common disease. Okay. Okay, so work on this. Okay, if you are not sure where to begin, okay, this is Medicorp department welcoming session. Okay, okay, so if you have another device or second screen, or you can do this later, go to your browser, Medicorp Teachable. This is Medicorp punya online platform, online course platform. Okay, it will bring you to this page. Okay, so this is a department welcoming session. Okay, ada 3 courses that I highly recommend you to finish before you start taking. So you have 6 weeks, doctors, right? Okay, these 3 free courses saya sangat recommend untuk you completekan. Okay, fix your schedule, 1 hour a day ke 2 hours a day. Okay, so first is welcoming session. Okay, second is excellent doctor series, free as well. This is by your specialist, internal medicine specialist, Dr. Afiq Rahimi. And the third one is HO role in OT and how to book case for operation. Boleh, doctor? HO role in OT, excellent doctor series, and department welcoming session. Okay, all these are free, and this is how it looks like. Okay, so untuk department welcoming session, okay, so your MO and specialist, akan bagi tahu you apa common cases dekat PITS. Okay, ini Dr. Husna, pediatrician. Okay, dia bagi tahu kalau you're starting at peds, bukan first posting sahaja. Mungkin dia akan berguna untuk your second, third posting nanti. Apa common cases dekat peds? Apa you punya rotation dekat peds? Berapa lama kat general ward, dekat SCN or NICU? What are the common cases? What do we expect from you? Ada a few case discussion. Okay, same goes to other department as well. So boleh doktor, at least starting tomorrow you start one department per day. So you dapat tahu apa yang common, what are the common cases kat ONG. Okay, so in fact for ONG, we cover how to do rounds, okay? How to do rounds for your postnatal case, antenatal case. This is example of very, very simple case. So that you understand how to do rounds, how to plot pathogram. Okay, so this should be a good start. Sementara you nak settlekan you punya LHDN lah, medical check-up and everything, work on your skills and knowledge as well. Okay, doctors? Okay. So the 3 causes: department welcoming session, excellent doctor series. Okay. This one ada common diseases, hypertension, making referral, okay. Especially yang dah join advance, you must be, insyaAllah you'll be able to appreciate this topic much better. Ada different practice. This is common cases yang you kena refer kepada medical, especially when you are in ortho ke, surgery ke, okay. Okay, so I hope that will be helpful. Those are free courses, okay. Siap ada slide, you can download and print out to help with your revision. Okay, and if you think this is a free module, nanti saya akan share dekat saya punya Telegram channel, Ampang Hisho Guide. Those are free resources that you can use for your preparation. If you think you need more help, then you can enroll in the online course by Medicorp. Okay, so my team has made available all these courses for 4 months punya access. Okay, so it is much more affordable. Okay. Okay, there's a link to Medicorp Teachable School and also how to register for online courses at the comment section, okay, in the chat section. Okay, so moving onwards, okay, so your 5 core skills, work on this, revise, slot in every day, okay, apart from the mentorship revision. And then core skills is something you need to do. Okay, this one might you tak boleh nak practice sangat lah before start houseman, okay, but if you are equipped with the 5 core knowledge, you will be able to do this all skills much easier lah, okay. So what to ask patient during clerking, review, okay. Most of us were trained to clerk patient in English, okay, or all the questions come out in English. I graduated from Russia, so all the questions come to me in Russian. So you need to translate. Kalau siapa yang dapat dekat Sabah, Sarawak, or dapat dekat Kelantan, so you will need to translate to the local dialect. They will need some practice lah, okay. Okay, what to document? Yang ni you boleh tengok dalam Ampang Hisho Guide nanti, Amalina Notes. There's a lot of example of documentation. You will be able to learn the abbreviation as well. Okay, those yang dah join Flash and Advance, so revise the slides, okay, the example of documentation, okay. How to communicate? Okay, this one, we will have a few practice dalam mentorship revision later. Okay, you can have a look dekat Teachable tadi kan, ada contoh how to post case for operation, how to do referral. Okay, dalam advanced HO ada a few practice how to present and inform cases to MO and request can as well. So I hope that will be insyaAllah enough for you to understand how to do it when you go in as houseman later. Okay. The only thing that need your extra effort is this: how to perform your physical examination. Doctors, please practice your steps of physical examinations. Okay. Waktu you nak final exam dulu, you are really good at it. Those yang local grads, okay. So keep the skills intact. Practice on your spouse, practice on your family members. Boleh? I have concern for those who graduated from overseas. Okay. You need to make sure whether the steps that you have been taught during medical schools is the same like what we practice in Malaysia. Okay, contoh kalau dekat Russia, the step is totally different. I don't know if you graduate from India ke Indonesia or Ireland, UK. Okay, I don't. If the step is the same, then you will need to practice. Make sure you ingat the punya step. Part of your assessment as houseman, your mini CX will include the step-by-step physical examination. Okay. If you are from overseas graduate, okay, and the step is different, okay, yang kita belajar dekat medical school tu lain dengan apa yang kita practice dekat Malaysia, so you will need to relearn all those steps. Okay. And procedures, common procedures as per HO logbook. And if you think you need practice, my team has added more session of clinical skills workshop. Okay, siapa yang dah pernah datang dahulu, you are most welcome to join as volunteers. Okay, assist my team during the practice, and you can practice all the procedures again. Okay, if you are staying afar, tak sempat nak join, you can just get the book. Okay, this is clinical skills guidebook. Okay, siapa yang datang workshop, dia akan dapat free. Kalau you tak sempat nak attend the workshop, at least get this book. Okay, we have all the indication, contraindication, pictures of items you need to prepare for the procedures. Okay, there's a lot of QR code for you to watch how to prepare for the procedures and how to perform the procedures. Okay. Okay. How to buy the book? You can go to Medicop store. You Google je, insyaAllah jumpalah. Okay. Kalau you nak go to the online platform, Medicop Teachable. Kalau store, Medicop store. Okay. 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 So I hope by now you have a better understanding and crystal clear clarity of what is expected from you on your first day of life. Also dah jelas what is your job scope. Now you must be able to point out, okay, mana yang you are quite confident, mana yang tak confident. Okay, so from there, plan how to close the knowledge and skills gap. Okay, nanti when you go through the department welcoming session, MO and specialist, you akan list down kan apa common topic. So work on those topic that you feel macam dah lupa atau you're not confident. Okay, it's okay if you cannot cover everything. It's okay, but you need to get you need to start somewhere lah. Okay, start somewhere. Okay, jangan masuk houseman zero macam kamikaze je, no Okay, this is how to do rounds. Okay, you boleh tengok dalam department welcoming session on ONG. I give a few example. How to formulate plan of management. Most of you are quite well versed because we have done a lot of practice dekat flash and advanced HO. Okay, how to prescribe medications. Okay, and this is example of off-tech assessment. Okay, I will share my slides dekat my Telegram channel so that you can have a look at them later. Okay, so this is example of off-tech assessment in medical. They want to make sure that housemen know how to attend common emergencies in the ward. If patient ada shortness of breath, hyperkalemia, hypokalemia, what are the ECG changes, what are the history, okay, what are the predisposing factor, apa patient punya clinical manifestation, okay, and how to manage hyper and hyperkalemia. All these are HO level, means as HO you must be able to calculate the potassium deficit and calculate the correction and start the correction lah, okay. Chest pain, ECG, chest x-ray, okay, shortness of breath, include your ABG as well. So regardless any posting you start, you must be quite prepared on this, okay. So Medicop cover this. The speaker is your internal physician specialist, okay. They will share you examples on how to attend all those common medical emergency. On ABG, there's a lot of case discussion as well. Okay, it's not just a theory, ada case discussion so that you can practice. Okay, hopefully you're quite confident after you complete the modules. Okay, okay, and this is example of tech assessment in pediatric. Okay, so they list down what are the common topics you need to be able to clerk and propose the plan of management. Okay, you can see the PIDS posting ada two division, general pediatric and neonates. Okay, they expect you to work on your clinical knowledge and also your skills. Okay, so bila you dah masuk dalam senior houseman punya group, these are one of the things you can ask from your senior houseman, the tagging log or tagging form. Okay, okay, so this is example of mandatory topic from HO logbook. Okay, I took this from Medicop punya HO logbook compilations. Okay, we help you to prioritize daripada 16 mandatory topics ni. These are the common ones that you will encounter in your wards. Okay, these highlighted cases makes up most of the diseases. Okay, so kalau you boleh tengok, it actually resonates sama macam dalam tagging log ni. Pneumonia, bronchiolitis, bronchial asthma, febrile fit, dengue, AGE, NNJ, IDM. Okay, sama. NNJ, IDM, respiratory stress of newborn. Okay, AGE, bronchial asthma. So common is common, at least go through the common cases and emergencies. Okay, this is what Medicop cover in the online course. The speakers are again your medical officer and specialists from respective department. Okay, okay. Okay, so if you think you needed help, we have the recording of flash HO induction. Okay, and advanced HO induction if you think you need more help. Okay, the link is as my team has shared through our own pay system, Medicop on pay. You can simply Thank you, yang share link. Okay. We also have what simulation if you need a more advanced experience. Okay, we have our neonatology ward simulation tomorrow, and obstetric ward simulation in June. Okay, so yang ini you akan jadi houseman on 1 or 2 days. You will need to do exactly what HO need to do. There will be simulated patient for you to ask question, do rounds. Okay, okay. Okay, so now final part, okay, for mentorship revision. Okay, so mentorship revision doctors, saya akan bagi you all cases, okay, and tasks through WhatsApp. Okay, it will be sent directly to you. So tak ada group tau. Mentorship revision tak ada group. You need to save my number. So please save my number now. You only will receive the broadcast message if you save my number. Okay, selalunya broadcast ni orang business guna untuk blast promotion, Medicorp guna untuk blast revision. Okay, so the first step is doctors, please save my number. Second, please submit mentorship survey now. I've just shared the link to mentorship survey in the chat box. Okay, it will take you 5 to 10 minutes. Yang dah pernah submit, dah pernah join revision, please submit again. We want to assess whether your confidence level have improved after the intervention, and you can actually opt nak join lagi untuk second time atau tidak. Okay, no pressure. Okay, we just need your cooperation to submit the survey, and at the end of the survey you akan dapat link untuk join WhatsApp group senior houseman. Can we do that now, everyone? Okay, so you boleh terus dapat akses, terus masuk senior houseman punya group, and you can start asking question.